And once again, good morning, everyone, and good evening to the other side of the world. Bonjour tout le monde. Magandang umaga at magandang gabi sa inyong lahat. I'm Ariana Perbilio, the FNAQ PRO and Director of Communication, and your moderator for today's event. Today, we are gathered for the annual Filipino Nurses Association of Quebec's Educational Day. For the first time in the organization's history, the FNAQ Educational Day for the year 2021 is being done in the virtual world. Despite of the unusual setting we have for this event, we are hoping for an interactive educational day for everyone. The topic for this year's Educational Day is Strenghts-Based Nursing Care and its relevance in today's nursing profession. As the person pioneering in this topic, it will be discussed by our guest speaker, whom will be introduced formally later. For this, we encourage everyone's participation, so you have the opportunities to submit your questions to our chat box at any time during the presentation later on. To formally start this event, may we call on Mary Grace Ocampo Goldenberg, the FNAQ President for the current term 2020 to 2022. One of our continuing education directors, Ms. Aiza Alam, will then introduce our guest speaker for today's Educational Day. The floor is yours, Ms. Ocampo.
Good morning, everyone. Magandang umaga po. Magandang gabi po sa mga participant natin nasa Pilipinas. Good morning, everyone, again. It is an honor to have you all on our annual Educational Day via Zoom for term 2020-2022. As what Ms. Parvilla said, it is a first time in our organization history. It's been a tough to everyone because of this pandemic COVID-19. A lot of our loved ones got affected of this virus. The world had changed. Even though it will be via virtual, we will make sure that this educational day will be interesting to everyone. Please let us give a warm welcome to our participants from the Philippines who is joining us today. Dean of Nursing Attorney and RN, Mr. Sales Alibogha. May you say something? So, Ariana, can you focus? There. Hi.
Hello, good evening, everyone. I'm glad that I'm part of FNAQ Educational Activity. I have the book of Dr. Gottlieb, and it's fun reading. It's a very excellent book, and I'm sharing it to our friends.
It's 7 p.m. Thank you for joining us today. And let me mention to you our advisory board, which is Miss Lynn De Palma. Miss Laurie Gottlieb is as one of our advisor too, our speaker today. Miss Georgia Niarcos, Miss Patricia O'Connor, Mr. Alejandro Robles, Mr. Fruan Tabamo, Miss Lucy Tremblay, and for our founder, Elena Balesa Calceras. And to all our participants, thank you for joining us today. This is our first Zoom Educational Day, and we will make sure this is gonna be interesting and very interactive. Now, Ariana, introduce Isaac. Thank you.
So you can have the floor now, Ms. Aiza Alam, to introduce our guest speaker.
Okay, good morning, everyone. My name is Aiza Alam, one of the executive director of the Filipino Nurses Association of Quebec. Welcome to our first annual Educational Day for the term 2020-2022. It is my great pleasure to be here and to introduce to you our keynote speaker for today's event, an honorary member and advisor of the Filipino Nurses Association since 2019 and still counting. She has been an active speaker of the organization in the past. The most recent one was last 2013. She is a professor at the Ingram School of Nursing, McGill University, Montreal, Canada, where she received her bachelor's and master's degree in nursing, as well as her doctorate degree in developmental psychology. She has been a member of the McGill faculty since 1974 and was the director of the School of Nursing and associate dean of the Faculty of Medicine from 1995 and to 2000. In 1992, she became editor-in-chief of the Canadian Journal of Nursing Research, which she held for 22 years. Under her leadership, the periodical became the premier forum for nursing research in Canada. In 2013, she published her first book, the first edition of her book entitled Strengths-Based Nursing Care, Health and Healing for Person and Family. The book was awarded first place in the 2013 American Journal of Nursing Book of the Year Awards in the Nursing Education category. This landmark publication was a practical guide for nurses on how to incorporate the knowledge, skills, and tools of strengths-based nursing and healthcare into everyday practice. So strengths-based nursing is the result of an evolution of her thinking into what is nursing and how should nurses fulfill their social mandate of health and healing. In 2014, she founded and a co-director of the International Institute of Strengths-Based Nursing and Healthcare. She is the principal investigator of the multi-site, multidisciplinary partnership grant entitled Transforming Nurses' Work Environments through a Strengths-Based Leadership and Management Training Program co-funded by the Canadian Social Science and Humanities Research and the Canadian Institute of Health Research. She has authored numerous books, chapters, monograms, and peer-reviewed articles. Her works have been translated into different languages, such as French, Japanese, Spanish, Portuguese, Korean, and Dutch. She also holds the Flora Madeleine Shaw Chair in Nursing from McGill University. She is the nurse scholar in residence at the Jewish General Hospital, a McGill University teaching hospital. She is also recognized for her contribution to nursing and has received the Canadian Nurses Association Centenary Award, the first and one-time award, only award from the Canadian Nurses Association, recognizing the 100 most influential nurses in Canada. She also received the Insigne du Mérite Prize, the highest recognition accorded to a nurse from the Order of Nurses of the Province of Quebec, and the Prix de Conseil Interprofessionnel Quebec, a recognition bestowed by the Interprofessional Council of the Province of Quebec. Lastly, she was elected to the Canadian Academy of Health Sciences and received an honorary doctorate from Université Laval. So the multiple roles and functions played by nurses are particularly important during this COVID-19 pandemic. So we believe that a strengths-based nursing care approach would be very helpful in today's situation. Without further ado, please let's all welcome our guest speaker, Dr. Laurie Gottlieb.
I think.
Good morning, doctor.
Thank you very, very much, Isa. I'm listening, and I don't. When you did your introductory remarks, I think it's all very well and nice and lovely, but I don't recognize myself in it. I just know that I have been so passionate and committed to nursing since I trained at the Jewish General Hospital in 1963. I'm telling you my age. But the same passion and commitment that I felt when I came into nursing has lasted all these years. So whatever recognition I've had or whatever I've done has something I have not really looked for, because it's the work of nurses and nursing that really motivate me. But thank you very much for sharing those accomplishments. You live long enough, you accomplish enough. I have a very special place in my heart for the Filipino Nursing Association and for my fellow friends and colleagues. I so feel a part of your community and so admire your community. And I so overwhelmed by your continued support of me and your continued inclusion of me in all your activities. So I thank Mary Grace, I'm sorry, Connie, the board, and of course my dear friend Maggie, who brought me into this community and has continued to embrace me all these years. In the meantime, I will start that, yes, in 2013, I was honored to introduce to your community Strengths-Based Nursing. So what I'm going to do is do a little bit of a recap of the basics of the fundamentals of strengths-based nursing, but there has been so much activity and so much progression since that time that it's quite overwhelming, the amount of work that has been going on and the adoption of SBNH. We call it SBNH, Strengths-Based Nursing and Healthcare worldwide. Let me, before we get to my screen, we call it SBNH, Strengths-Based Nursing and Healthcare. People have asked me to drop the nursing in the title, just have a strengths-based care or strengths-based healthcare, and I absolutely said no. If I drop the title nurse in the name of what this is, this was an approach, a philosophy developed by nursing, by me, which I'm a nurse, informed by nursing and for nurses. And if I drop the word nursing, I would make us invisible. This is about being visible and being proud of who we are and our contributions to healthcare. We've included healthcare, SBNH, health care, in the title because many professions, healthcare professions, are very attracted to, and these ideas really resonate with them. So to be very inclusive and to say we include everyone, because if everyone would adopt this approach, we would have a very compassionate, humanizing approach to healthcare. So that's why when I say SBNH, it means strengths-based nursing and healthcare, and the nursing will always say in the title. I have said that once I'm gone, you could do what you want, but as long as I'm alive, nursing will be front and center because this is what it is. It's a nursing approach. Okay, here we go. Okay, we're finally on our way, ladies and gentlemen. Okay, so today I will be talking about strengths-based nursing and healthcare. And hold on, I'm having problems now. And what I will be talking about is why SBNH, the reason for what I'll be giving you a sense of the fundamentals and how we are trying to create an SBNH culture, both here in Montreal, but also nationally and internationally, worldwide. So before I start, while I'm talking, maybe just jot down some keywords or ideas that you associate with SBNH. And perhaps think of an incident from your own nursing experience that has left a deep impression on you. Because if it's left a deep impression on you, you will be able to identify elements of SBNH. If it's a positive experience, I am sure you'll be able to identify elements as I talk of SBNH. You might not have called it that, you might not have recognized it, but it is there. And if it's a deep impression that was a very negative and painful experience, it's often because it did not have elements of SBNH in it. So I'm just going to go through why SBNH. As we all know, 2020 started as a very exciting and hopeful year. At the time of 2020, I was in London, England, and was there to also present SBNH at a symposium at the Commonwealth Conference. There was so much excitement about 2020 because the World Health Organization declared it as the Year of the Nurse to coincide with Florence Nightingale's 200th birthday. And the call from all the leadership and professional organizations in nursing was that it was time to make nursing visible, so that we could encourage investment in nursing. For too long, nurses had not been given the recognition nor the financial investment that was commensurate with their contributions. And I am talking about worldwide. But COVID-19 came shortly afterwards. So this is January, when it was declared the Year of the Nurse, the official openings at the Commonwealth Conference in London in the early March, and then COVID-19 really came. I'm just reading a fabulous book on this pandemic, and basically it made nursing visible. And so what COVID-19 did, it really amplified nurses and nursing's contribution. We have always said that nursing was the backbone of the healthcare system, but COVID-19 revealed that yes, indeed, nurses were the backbone of the healthcare system. I have been gathering stories, nurses' stories of COVID-19, so we have an oral history of what this event was like for the CIE Centre West, and nurses described that they, for the most part, they were the only ones that were manning the ship. They felt abandoned by many of their other healthcare professionals, as people retreated into their home, and nurses were there on the front lines taking care of patients. And when they talked about a collapse of a healthcare system, they were talking about not having enough nurses. We also saw the unbelievable compassion and caring that nurses provided. And in fact, one person I spoke to, a wonderful, wonderful woman at Maimonides, she talked about selfless compassion. She put herself in she put her patients and families and their needs and prioritized that to her own needs, and opened up her heart and provided so much compassion, limitless compassion. And in fact, it's this compassion that really reaffirmed her connection and her commitment of why she chose nursing. We rediscovered the fundamentals of nursing care. Because this was a novel virus, no one had treatments. It was through nurses' astute observations that they really attended to the basics of care that Nightingale talked about: ventilation, positioning, attending to basic physical needs, the emotional and psychological caring. And nurses showed that they have the knowledge and the expertise to provide safe, quality care. They kept their patients safe. They, through observations, they innovated. They figured out, best positioning and turning, because there was at that time no directives, no rules, and nothing to guide them. And it was through their unbelievable astute observations and returning to the basics. And they partnered with families, because families could not be there. They were the ones that held patients' hands and soothed patients in their most anxious moments. They soothed patients and families. They were there when patients were dying. They were the ones who accompanied patients to give them a peaceful death. And they were the connections with patients and families to really partner in terms of how best to care for their loved ones. And colleagues stepped up and they helped each other figure out how to care for patients as patients were moved, and they had to create COVID wards. All of a sudden, non-COVID wards had to receive patients that they had never seen before and didn't have the expertise. And those colleagues came down from their units to new units in order to teach nurses. So it really amplified nurses and nursing's incredible contributions to the healthcare system. And we just hope people will not forget this. But it also exposed the fault lines in the healthcare system, that it was a disease-oriented system. We all know that healthcare is a misnomer. It's not a healthcare system. It's basically an illness disease-oriented system. And in fact, it was a dismantling of the public health and the prevention aspects that really were responsible in many ways for not dealing with COVID early enough. I'm reading a fabulous book just on this very topic, that the public health system was totally dismantled because all the focus and money had gone to disease. And we know that it's a deficit-based system, that you focus just on the deficits, and I'll be coming back to it. We also saw the fragmentation in the system, because we saw what happened in long-term care. We saw that those people in less resource areas really didn't have the healthcare that they needed. And we found that this focus over the last 30 years on efficiency, making everything efficient, rather than focusing on effectiveness and compassion and caring, really undermined the effectiveness of the system. And this very hierarchical structure that exists, where we can see the hierarchical structure both in terms of professions and in terms of organization, allowed a system to be very sluggish, and not being able to be flexible enough to quickly move and to be agile enough to respond quickly as things were quickly unfolding. So these are the fault lines in the healthcare system that must be addressed if we are to reimagine a new healthcare system and never find ourselves in the situation and the position that we have found ourselves these last 14 months. Now, this I need to talk to you about, because this is London, England. This is on the south side of the Thames. It's in the South Bank. My daughter lives in London, and she's a big walker, and you can see Big Ben in the background. And this is a wall. This is the National COVID wall that has been erected. And my daughter sent me these photos because she found them so moving. It's people putting hearts on people with whom they lost. So it's a wall, and unfortunately, it's a very long wall, because there has been so many deaths, and not talking about the morbidity, but so many deaths due to COVID. And so this is a wall that you can see. And my daughter knows that I have a very special place in my heart for Filipino nurses and for the Philippines. And so she took this photo of the Philippines Heal Our Land, and it's about the NHS and nurses on the front lines. And then she also took a photo of these names, and these are Filipino nurses who have sacrificed and who have given their lives to care for other people. To me, and I get very, very emotional about this, I feel that Filipino nurses have been the caregivers of the world, and they disproportionately have sacrificed more lives during this pandemic than almost any other group. So many nurses have sacrificed their lives, but Filipino nurses have been really, unfortunately, the ones who have really absorbed and taken the toll. And at the bottom, you see the word Jen, and this is one Filipino nurse and her co-workers have come to honor her memory and her sacrifice. So I thought we would start with 1 minute of silence for all healthcare workers and healthcare workers who have paid the ultimate and highest price to care for us and to preserve our healthcare system. So let's take 1 minute of silence, and then I will continue with my talk. So we'll start now. Okay. Okay. So I find this very, very moving, and I think we need to continuously remember all those who have given of their lives to keep us healthy and safe. I, for one, have a very deep gratitude. So now let me continue with my talk, which is what is the vision and mission of strengths-based nursing. And Florence Nightingale gave us our social contract, and the social contract means this is what nurses have contracted with society. This is the focus of nursing, and in exchange, society should be affording us the respect and the esteem and the regulation of our own practice. So Florence Nightingale talked about promoting health, which was just not the absence of the illness, but developing to our fullest potential, developing our strengths. She talked about facilitating healing through creating healing environments that capitalize on our innate capacities for healing and alleviating suffering. The vision of strengths-based nursing is to humanize healthcare through compassionate, knowledgeable, strengths-based nursing. And so many of my ideas are rooted in Florence Nightingale. Whenever I get discouraged, I go back to Nightingale for inspiration, and her ideas are just as relevant today as they were when she wrote them in 1860. So what is SBNH? I'm going to just identify 4 aspects, and then I'll be elaborating and describing each. First, it's an alternative worldview to the deficit model. It's both a philosophy, mindset, and orientation, but most important, it's a value-driven approach. And it doesn't only guide clinicians, it's the same values that guide leaders, educators, and research. It's a way of thinking and a way of approaching the world. And of course, it's about strengths. It's about uncovering, discovering, mobilizing, and developing strength to promote health, growth, and flourishing. And it's about leveraging those strengths to facilitate healing in order to maximize functioning. I'm having trouble moving my, okay. Oh. Okay, so I'm just having a little problems with my slides. Okay, so SBNH is an alternative worldview to the deficit model. Let me explain this to you. Now, this is a conference that was held in Quebec. It was an international symposium. It was called Triosynimia, and it was held in 2015. And I was invited to this conference to talk about strengths-based nursing. I was the only nurse amongst all the medical colleagues. Now, tyrosinemia, I had never heard of it, and I don't know how many of you do know about it, but just to quickly tell you, it's a metabolic disorder in which a child is born, it's genetic, it's inherited, born without missing a critical enzyme to metabolize protein, to metabolize amino acid. And without the ability to metabolize amino acid or protein, there's a high rate of liver and kidney failure and a high rate of infant death. It affects about 1 to 100,000 to 120,000 births worldwide, but in Quebec, it affects 1 to 16,000. And in the Saguenay region, in Lake Saint Jean region, it affects 1 to 1,850. So it's a huge medical concern and a medical issue in Quebec and specifically in the Saguenay. So this was a medical conference in which I attended. I gave a talk in the morning amongst all the other, with all the other invited speakers who were medical doctors who were talking about the latest developments and the latest medical advances in the treatment of tyrosinemia. I was, of course, talking about nursing and the care of these patients. But the doctors, I kept on hearing one refrain. The doctors expressed how really frustrated they were with the parents, because if only the parents and the children would comply with their advice and would follow their medical regime. And so they were very frustrated with these parents and very critical of the parents. In the afternoon, I was invited to meet with the parents, and the room was jam-packed. There were so many parents there, and all they wanted to do was to share their experiences. And they shifted in the afternoon. They were eager to share their experiences and to be given a forum to express their challenges. What they told me was that there was a lack of recognition on the part of the healthcare providers about the challenges and the difficulties that they faced with with caring for a child with this condition. They perceived the healthcare professionals as not caring, and that they didn't understand their concerns, or if they did understand their concerns, they tended to minimize them. They reported a lot of blaming. And one mother told me in particular, she told me that the doctor told her that if she didn't comply with the regime, they would know about it because it would show up in the child's blood values and blood tests. One mother put up her hand and told me about the challenge she had. What should she do? She had a teenage son who was hiding peanut butter under his bed. And she was just beside herself. And I said to her, congratulations, your son is acting like a normal, healthy adolescent who is trying to figure out and exercise his independence. But our goal, like any other parent's goal, is how to launch them into adulthood and how to help children learn how to take care and take greater responsibility for their own care. And she then came to speak to me afterwards, and she was very, very grateful. So what do we know from this? Here we have two concerns, part on the medical profession, the healthcare providers, and part on the parents. And they are both have quite different perspectives on the very same situation. And because they share such different perspectives, there is a breach, there's a chiasm between the two. Both want the very best for that child. The medical profession wants the very best, and the parents want the very best. But somehow they're at odds, and they cannot seem to talk to each other. And part of the problem is that the medical profession is coming with it from a predominant model of practice, which is called the deficit model. And the deficit model, if you look at this first slide, is a chain. And although there's a chain and there's many healthy things and that are working in the chain, they tend to focus on the problem. They tend to focus on that which is missing, not that which is also working, but that which is missing. And their focus is to just focus in and laser focus on problems. They have an attitude that experts have the power and they can fix anything, rather than the solutions resting as a partnership with those who are experiencing the problem. But there's this notion of the power to fix, and that they have the power and the tools to fix anything. And when a person doesn't comply, when things go and not as expected, there's a tendency in the deficit model to blame, to criticize, and to pathologize. And so this is really, I have outlined what is the difference between strengths-based nursing and healthcare and the deficit problem-based. And if we look at it, we can contrast the two different approaches and why SBNH is an alternative worldview. The deficit approach focuses on the disease, the pathology, while a strengths-based approach takes a more holistic, health-promoting, living with, understanding people's experiences. The deficit approach focuses on fixing, whereas the SBNH approach looks for possibilities, opportunities, that families will find their own solutions with guidance and with education. One focuses on having patients and families comply with the medical regime, while the strengths-based says it's a negotiated approach. We have to find an approach and a way of helping patients adhere to their medical regime, but one that makes sense to them and fits. And that's why it has to be collaborative. One is very paternalistic, in which I know best, versus a partnership approach, which is we're both bringing expertise to the situation. You are the expert in your life, your situation, your knowledge of your children, but we have expertise as a nurse, as a professional that we can share together. One is about doing for, and the other one is about doing with, because if you're in partnership, you're doing you need to do it with another person. One is telling to, and one is learning from. Our best teachers are our patients. Our best teachers are the people that we work with. Our best teachers are, we need to learn how to listen to them very carefully and then to engage them. And so one is about contextualizing and situating and understanding their situation, their circumstances, in order to come out with the best way of caring for them. One's a detached approach, and one's a very engaged facilitator coaching approach. So that's really a summary of how these two different approaches really differ from one another, and that's why it's an alternative worldview. Now, it's not to say that SBNH does not deal with problems or deficits. Of course it does, because the reality is that problems and deficits are just one part of the whole. I'm saying, and anyone who subscribes to this approach saying, but strengths are also part of the whole. And it's really in looking at both problems and deficits as well as strengths, looking at the whole and seeing what is the relationship between the two and how one can be leveraged in order to deal with the others. So SBNH, this is the second aspect of SBNH. It's a philosophy, it's a mindset, it's value driven, and it can guide clinicians, leaders, educators, and research. And let me explain to what I mean by this. It's not something that you apply, it's something that becomes part of who you are. It's a mindset, and a mindset is a set of beliefs that permeates every part of one's life, that affects the way one sees and responds to situations. One can choose one's mindset. So if you choose to have as a mindset SBNH, this is a deliberate, intentional decision. And SBNH is, as one of my colleagues say, it's a way of being. It's how you show up in the world, whether you're a nurse, a leader, an educator, a parent. I had given a talk on a strengths-based parenting. It's how you choose to show up. And SBNH then becomes one's professional identity. And when I listen to nursing that is satisfying and effective, and where nurses are proud, I always can identify that these nurses embody so many of the qualities of SBNH. They might not have the terminology, they might not have recognized it, but they embody many of the qualities and values of SBNH. So a philosophy helps to guide and direct, and I'll be explaining this a little bit more. Now, this is something that I discovered. So I had written these books based on these values, about that these values could guide clinicians in how they care for and nurse their patients. And then somebody asked me to write an article for a leadership journal about how to implement SBNH. And when I was thinking about it, I thought these same values work, and they could be used to guide a leadership style, a way of managing staff. And then I did the same thing for teachers, and these same values could be used to guide teachers in creating environments. So in terms of practice, clinicians create healthy environments to promote health and to facilitate healing. Educators promote healthy learning environments to help students grow and develop and learn. And leaders create healthy workplace environments for their staff so that their staff can then be able to practice within this way. So they're all operating around the same values, and all these values of care align together, which strengthens them. And I will be coming back to this in a moment. Marianne Williamson, who ran as a Democratic candidate, did say something interesting. She said, you must learn a new way to think before you can master a new way to be. So SBNH is a way to be. SBNH is about, this third aspect is about strengths, it's about noticing, uncovering, discovering, and developing strengths. Now, it's not surprising that the deficit model is the dominant model, because as humans, we are wired to see deficits. We are wired to pick out the weakness. We are wired to see danger. If you look at this photo, as you can see, hiding in the bushes is a lion. If we were not wired to look for danger, we would not survive. And so there is a negativity bias that exists within all human beings, and our memory tends to store more negatives than positives. You could be in a movie theater enjoying a movie, and then the last minute of the movie, something terrible happens, and all you remember is that terrible thing. You don't remember all the enjoyable things that came for the first 2 hours that you sat there. So we are wired to remember those dramatic negative events. But we're also wired for strengths, because we need strengths in order to grow and function and thrive and relate to others. And we can rewire our brains for positives. So in other words, we could train our brain to really look for the positives. We don't always, I'm looking at in my garden, and sometimes all I see are the dandelions and the weeds, but I could refocus and take in the whole. I could appreciate my flowers. I'm looking at now right out of my window. I can appreciate the trees and how they're growing. I have to look at the whole, not just the negatives. Now, strengths exist at the biological be trying to redirect that energy that we use to deal with the pain. And if we manage it, we then can redirect that energy for healing, because the immune system is a biological strength that is trying to be mobilized. The vaccination is a good example. We're vaccinating in order to stimulate the immune system, which is an innate mechanism, and we're doing that to help for repair, restore, and growth. Strengths are needed for health and for healing. And we need strengths to motivate, to empower, and to engage people. People will be more engaged if they feel they have a vested interest, that this is about you, about that you're interested in helping them with their issues, not what's the matter with you, but what matters to you. And we work with strengths all the time. We care for strengths by supporting, supplementing, scaffold, compensating, protecting, etc. If you think of anything that nurses do, it is about harnessing the strengths, and it's about focusing on that which is working, so that we can, really mobilize that. The second aspect of SBNH is that it requires awareness, attention, and action. So before there's even a thought or an action, there is an intention. So before we do something, we always ask, what's the intention here? What are you trying to accomplish? So it's becoming aware, and then becoming aware of one's intention, and then working with intention and paying attention in order to guide actions. So SBNH, by laying out this framework, by laying out these values, helps you to purposefully say, this is what I want to accomplish, and this is what I'm going to, this is what I'm trying to accomplish, and this is what I need to pay attention to, and my actions will focus on that. Another aspect of SBNH is it's about looking and noticing strengths. And Henry David Thoreau, a famous philosopher, said, it's not what you look at that matters, it's what you see. So do you see strengths? Are you looking for strengths? Are you looking for capacities and capabilities? Are you looking for those things that you can mobilize and capitalize on, and that can be discovered, developed, and amplified? So I want to tell you the story. This is Nurse Christina Smith, and I write about her in my book. And she was a nurse in the pain clinic, and she's a clinical nurse specialist who definitely embodied this approach. This was her mindset. SBNH was her mindset, even though she had not called it such. But when we talked, it was, and I had not yet formulated all my ideas. She definitely was an SBNH nurse. So she told me a story of a very large, very angry woman that I called Mrs. Saunders, who had an 11-year-old son who suffered from intractable pain, and the pain was chronic. And Mrs. Saunders used both her size and her anger to bully and intimidate the healthcare team. In their first encounter, when Christina saw her, she saw that there is something that the other healthcare teams had not seen. Christina was told by the team that this was a very difficult, impossible patient. And so what the team members saw was this woman who bullied, this mother who bullied, and difficult, demanding, and uncooperative. She really focused on the deficit. But Christina saw a very protective and loving mother. She saw a mother who was committed to fighting for the best to get the best care for her son. She saw a woman frustrated and unable to deal with the healthcare system and healthcare providers who she considered the enemy, not her allies. And because the healthcare team had labeled, remember I said intention, attention, action, because they had labeled this woman as difficult, demanding, and uncooperative, their response to Mrs. Saunders was to avoid or deny or to ignore Mrs. Saunders. Whereas Christina saw a loving mother, but who didn't know how to advocate for her son to get the very best she could from the system. And so Christina worked with her to help her become aware of how her behavior was affecting the impact it had on others, to begin to change her way of getting the type of help she needed for her son. Her intention was to get the best care for her son, but to really begin to develop a new way of dealing with this. And she practiced with her, she role modeled, they rehearsed until Mrs. Saunders had really strengthened, had developed new strengths, new ways, and new skills of dealing with the healthcare system to get the best care for her son. So SBNH is about leveraging strengths for healing. And I'm going to talk about this in a moment. So what is the relationship between working with strengths and a strengths-based approach? So what are strengths? They are our natural abilities, our gifts, our core talents. They are our capacities, our capabilities, and our competencies. There's anything that we use that really define us, that define our own personhood and define what we bring to any situation. And they are skills. And so our role as nurses is to uncover, discover, develop, and mobilize these strengths. They are also potential. We might see a potential. Christina saw potential in Mrs. Saunders, and she helped to mobilize and develop that potential so that she could use her strengths in a much more productive and effective way. So we leverage strengths to optimize functioning. And I'm always reminded of, and as I said, there are biological strengths at the cellular level, there's at a personhood level, and at the unit organization level. And we're always asking, so what is working here? Like when we take a lab test, we look at the values that are not working, that are low or deficient or missing or out of kilter. But we also look at all the values that are there, that, that says, this is okay, this is okay, this is okay. And how do we leverage those values in order to contain or minimize or circumvent that which is not working? We do this all the time, when we're caring for patients who have had strokes. We're trying to capitalize and rewire that brain. And because the brain has the capacity, the innate capacity to be rewired, we work with the brain to rewire the brain so that we can compensate that which has been destroyed or not functioning. So it's a different way of thinking about things, definitely. So I want to talk very quickly about what are some of the properties of strengths. Now, many people have lists of strengths. When they talk about strengths, you get a category system or you get a list. So, and you could tick it off. So this person is, is tenacious, or this person is, kind, or this person's compassionate. Those are all strengths, absolutely. And I could give you a list and anyone could tick them off and say the people either have it or not. But I chose to go a totally different route. I chose to look at what are the properties of strengths, because if we understand the properties of strengths, we then know how to work with these strengths. We then could think about what we need to do. How do we create learning experiences? How do we create environments that really capitalize on these strengths? So the first property is that strengths are developing entities. So if we know that everyone is built, wired with certain capacities, like the capacity to walk, the capacity for autonomy, the capacities for connection. These will develop over time placed in the right environment, and the right environment will affect how those capacities and competencies will exhibit itself. So, for example, courage could look very different in a 5-year-old than in a 50-year-old. So these are capacities and strengths that really need to develop and will develop over time, but will be affected by the type of environment that people are placed in. I was just reading an article about in Romania when these kids, there was a whole generation of kids who had been abandoned and who were left to who were left in these horrible orphanages, and their inability to make connections. Well, that child was wired for connections. That child was wired for attachment. That child was wired for relationships. But being in a very sterile, unfeeling, uncaring environment really affected their ability to develop into a healthy human being. So when Florence Nightingale talks about becoming, that's what we're talking about. We're talking about health promotion. How do we help parents? How do we help the, how do we create environments that bring out the best of people's innate capacities? Strengths can be learned, and that's the beautiful thing about strengths. So we have the ability and the potential to learn. We are always teaching new skills. We're always broadening our horizons, like compassion. Some people are more compassionate than others, but compassion is a strength, a quality, a competency, a capacity that can be enlarged and deepened. And we can enlarge our repertoire. And the more time we give to understanding a situation, the more we modify it, reinforce, and learn, the more we develop our repertoire of skills. And strengths always coexist with weaknesses and vulnerability. It's not strengths versus deficits. It's how they are both coexist and how they are both found together. And here is Rabbi Ronnie Kahana. So I don't know how many of you know him. He was my rabbi who suffered from a horrible brainstem stroke and found himself quadriplegic. And anyone who would look at him might just look at what he can't do. But locked inside, it's a locked-in syndrome. Inside his brain is this incredible capacity to be, his inner spirit came out. And that's his wife, Karen. He comes from a very loving, phenomenal family. They didn't expect him to live. And now 10 years later, he is still productive, but he's a poet. And you have to see the whole man. You can't just see what he can't do. You have to also see the whole person. And he wrote this poem, "You have to believe you're paralyzed to play the part of quadriplegic." So he doesn't see himself as paralyzed. He says, "I don't. In my mind and in my dreams, every night, I, Chagall man, the famous painter, float over the city, and I twirl and I swirl. And with my toes kissing the floor, I know nothing about the statement, a man without motion. Everything has motion. The heart pumps, the blood races its course, the lungs culminate, the body heaves, the mouth moves, the eyes turn inside out. We never stagnate. Life triumphs up and down." And this he wrote while he was in this condition, just very shortly after he became a quadriplegic. And that's how he embraces life, and that's how he sees himself. So he is developing his strengths and his sensitivity as a poet while he is in a quadriplegic state, which he still is. Now, strengths are related to goals. And this is a situation that happened to me. This was my grandson who was born with a craniofacial condition. He's had multiple surgeries. And I was taking care of him while his parents were in Japan. And I had to take him to the doctor. And he heard doctor and he went absolutely ballistic. And we put him in the car seat and we were on our way to the doctor, and he was like, the magician Houdini. He found every which way to get out of his car seat. And, anyone could say, gosh, he's being so difficult, so naughty. And I thought to myself, what's his goal? He recognized he was under threat. He recognized that doctors were a threat that caused him pain. And he was going to do everything to save himself. And I thought to myself, good for you. His strength is that he knew he had the sense, and he was 3 years old at the time, a sense of self-preservation, and that was healthy. That was a strength. It wasn't negative, it was a strength. And the moment the threat was over, he was able to cuddle back into my arms, to down-regulate, and to self-soothe. So I thought, if anyone else would have scolded him, would be upset with him, I thought, good for you. You're going to know how to take care of yourself. And strengths are defined by their context and circumstances. We always think of, a blood pressure of 120/80. I remember being in the hospital with a patient who had a blood pressure of 120/80, and her normal blood pressure was about 160/100 or something. And the nurse, I kept on saying, there's something wrong here. And the nurse who was attending to this patient said, no, 120/80 is the perfect blood pressure. And I said, no, look at the chart. This is not her blood pressure. Well, sure enough, she was hemorrhaging in her colon, and she was going into shock. But that's why this strength, we can't just take it at face value. We have to look at the strength within context and the circumstances, and you have to know your patients. And strengths are multidimensional. If we look at the word love, it's made up of so many dimensions, and each of these dimensions, we have to understand those dimensions if we are going to help develop it. So love is about trust, and it's about joy, and it's about happiness, and it's about boundaries, and it's about compassion. And so just going back to that, so if we understand that dimension, then we could figure out how we might be able to develop and develop that as a strength. Another property of a strength is that it can be depleted and replenished. And we've seen this so many times. We've seen this on the part of nurses. Nurses are so empathetic, but there is a limit to how much they could take. And they have to recognize when they are depleted, and they need time out to replenish that strength. So everyone has a strength that can be eventually depleted, but we have to recognize the signs of depletion and when we need time out to replenish it. And finally, strengths are transferable. In other words, a strength in one situation can be harnessed and used for another situation. One of my former doctoral students told me about a strength that she was working with a woman in the community who was terrified of her son, who could be very violent. And this woman worked, on the streets. I don't know what they call her, but she had a job, and she said, you could recognize which men you should not go with. What are the signs you look for when you decide whether to go with a man or not? She said, are these the same signs you could look for when you're afraid of your son? And finally, strengths are personal constructions. So we each will, if you ask somebody, what are your strengths? They will have a good idea of what their strengths. Now, they might not see their own strengths, which you can notice or point out, but everyone has an understanding of what they see. And some see something more than it is, but it's about really trying to understand individual strengths. So I'll just go through this section, which is, it's a value-driven approach, and its foundations are operationalized through SBNH. So we choose our values, we have to prize our values, and we have to act on our values. So this is the SBNH value wheel that is grounded on foundations of person-centered care, empowerment, relationships, and innate capacities. And I'll go through that very quickly. So we have foundations, and they are operationalized in the values. So first thing is that SBNH is very person-centered. It values personhood. It values that people have to be involved in the decisions they make, and it's about consideration of what matters to people. What are their goals? What's unique? What's their circumstances like? The second foundation is one of empowerment, and we know that people, no matter how difficult their situations are, if they feel they have some aspect of control or that they could take charge, it really is one of the social determinants of health. So people who can exercise agency, have some control, feel empowered, they are healthier and they recover better, and we help in their healing. And we know that relationships are core to SBNH, and that it's all in terms of how we react and interact and connect with another person. And now we have a lot of neuroscience to show that connections and relationships are fundamental and key to health and healing. But we now have the neuroscience. We all knew this. We knew this when Nightingale was very focused on creating personal relationships with the soldiers during the Crimean, and how she took the time to write letters and to spend time with them and take the time to be with them and was attentive to them. And this is another concept, and this really comes from Nightingale, that we all are born with innate capacities for health. These are our potentials and innate mechanisms for healing. On the left is this sign of the Jewish, you have the power to heal. Who is the you referring to? Is it the mother who through skin to skin contact provides a warm environment for her infant to, her preterm infant to develop? Is it the nurse who creates conditions that allow the mothers to heal by allowing for skin to skin contact? So we all have the power to heal. We have to look at what are the innate mechanisms. In this case, it's the warmth of the mother's skin that's an innate mechanism that provides the perfect climate and environment for her infant. Now, this comes from Nightingale. Because this is Nightingale's very famous quote in 1860 when she talks about the difference between medicine and nursing. And she said, "It is often thought that medicine is a curative process. It is no such thing. Medicine is a surgery of functions. As surgery proffers, it is that of limbs and organs. Neither can do anything but remove obstructions. Neither can cure." Remember, doctors call themselves healers. We do not call ourselves healers. We believe patients are self-healers. We create the conditions for their healing. But nature alone cures, and what nursing has to do in either case is to put the patient in the best condition for nature to act upon him. And for nature to act upon him, what is nature? Those are the laws, God's given laws, and those are the aspects that we are all wired for that will allow us to have health and to be able to heal. So this is the SB&H value wheel. I'm not going to go through it, but you'll see I'm going to show you a videotape of how this helped to guide a nurse's practice. So this is a group of advanced practice oncology nurses that I had the privilege to work with. They were a talented group of nurses, and we met every 2 weeks to talk about their practice and to look at how their practice really could be guided by SB&H. And this is Andrea Cook at the end, and she's going to tell you about her patient.
I want to talk to you about Alexa and her mother, whom I met when she was 34 years old and just diagnosed with breast cancer. When discussing strength-based nursing, I want to focus on the last 2 weeks of Alexa's life. Something beautiful happened while supporting this family during this time, something that's almost impossible to put into words. Strength-based nursing made it happen. The relationship between Alexa and her mother had a long history of conflict that predated her cancer diagnosis. It was characterized by periods of support, and then conflict would occur, during which time they wouldn't speak for months. I found myself in a difficult position and chose to remain neutral while interacting with Alexa and her mother. There were times that Alexa asked me not to speak with her mother, and because of patient confidentiality, I would respect that. I met Alexa and her mother on the day that Alexa received her diagnosis and followed this family closely for the next 6 years until her death this past November. At the time of her diagnosis, Alexa was working and going to school part-time. She was not married, had no children, and was fiercely independent. While Alexa was undergoing treatment, her mother tried to convince her to move back home so that she could care for her, but Alexa refused. She remained in her apartment up until 2 weeks before she died. I came to appreciate how important it was for Alexa to be in control and to exercise control over her life and her situation. Yet it was also important for her mother to protect and nurture her daughter. Their needs were often at odds, and I found that nursing them was a delicate balance. This past fall, Alexa's liver metastases were no longer responding to chemotherapy. Tests indicated that her liver was starting to fail, and Alexa was admitted to hospital. Alexa's mother had told me that one of her greatest fears was to get a phone call saying that Alexa had been found dead in her apartment. It was important for her to be involved in Alexa's end-of-life care. However, without consulting Alexa, she began to make arrangements to provide end-of-life care for her in her home. I recognized that her mother well, but I also knew that Alexa did not want this. I asked her mother, if Alexa could not be discharged to your home, is there somewhere else she could be discharged to that you would be content with? She told me about a hospice close to her home that she would be able to visit often. Shortly after, unbeknownst to Alexa that her mother had talked to me, Alexa asked me, is it too late for me to go to a hospice? I told her no, that it was actually a perfect time to look into this. We spoke about different options, and she finally said she liked the idea of going to a hospice residence that would be close to where her mother lived. After our conversation, Alexa took a deep breath and said, wow, I feel like a huge weight has been taken off my shoulders. It's weird getting excited about planning hospice care, but now I realize that regardless of how much time I have left, I am in charge of how I spend that time. The next few days were spent working on the application to the residence. I sat on the side of her bed and quietly read out parts of the application for her to sign. She said to me, okay, let's do this. The application was accepted and Alexa was transferred to the hospice residence. The morning she left the hospital to go into hospice care, Alexa got herself dressed. Apparently, when she got to the residence, her room had floor to ceiling windows on one wall that looked out onto snow-covered trees. According to her mother, Alexa visibly relaxed, and within 2 hours of arriving at the residence, she slipped into a coma. She died 2 days later with her brother and her mother at her bedside. So now that I've spoken to you about Alexa, I want to speak to you about how my nursing interventions were guided by the values of strength-based nursing. When I helped Alexa and her mother both achieve a level of peace and acceptance, I was being guided by the value of healing. When I honored Alexa's need for independence and being in control, I was being guided by the value of uniqueness. When I appreciated both Alexa and her mother as individuals, as well as their interconnectedness, I was being guided by the value of holism. When I understood both Alexa's goal and her mother's goal for end-of-life care, I was being guided by the value of created meaning. When I was present and listened carefully to Alexa and her mother's fears and was able to alleviate their fears, I was being guided by the value of person environment. When I discussed end-of-life options with both Alexa and her mother separately, I was being guided by the value of self-determination. When I listened for cues that Alexa was ready to discuss where she wanted to die, I was being guided by the value of learning, readiness, and timing. And when I respected both Alexa and her mother's needs and goals and worked to find a common ground, I was being guided by the value of collaborative partnership.
I think I might skip. These are some of the essential qualities that nurses need to have in order to actually practice SBNH. Maybe I'll just go through it very quickly because I see I'm rushed for time because we started so late. The nurse, first of all, has to have a set of attitudes, beliefs, and values that affect one's way of behaving. They have to be mindful. They have to have humility so they could listen to other people rather than arrogance, and they have to be open and non-judgmental. They have to have strengths of knowledge and knowing. It requires, it's about having the need to acquire and use information and give rise to new ideas and to seek out new information. Strengths-based nurses need to constantly be learning, expanding, and developing either knowledge, theoretical knowledge, or knowledge from experience. So they need time to be curious and ask questions and to take time to reflect and self-reflect on what they've done and to learn from their own experience and from others' experiences. They need to obviously have strengths of relationships, how to create, maintain, and sustain relationships with their patients and with their colleagues. And this involves how you develop trust, how empathy and compassion. And finally, they need to have, oh, something's missing, strengths of advocacy. They need to be able to advocate for their patients, for their colleagues, for nursing. And this is developing a can-do attitude, having courage, and being able to really, buck the system and to really speak out and discover voice. Oh, that's in the wrong thing. I'm going to skip this one. If we have time, we'll go back to that. But how do we create this SBNH culture and practices? And basically, it involves all of us. It's not whether it comes from the directors of nursing or the head nurse, but it comes from both the head nurse, the point of care nurses, those giving care, managers, leaders, and the organization. And that's what we're discovering. In the years that I spoke to you, I have been very involved with several hospitals, 2 in Ontario, several in Quebec, and we really looked at what was the process of implementing strengths-based nursing into, so that it became the philosophy of practice of nursing. And it was about a pre-commitment phase, which was raising awareness, deepening understanding, trying out ideas that people found, and then retraining people, reforming, rediscovering what they're already working with, and forming networks. But the article has been published. Bruce and myself published that article. I'm having trouble now. Hold on. I want to talk about how it begins with each one of us can make a difference. And here is Jeanette shown, one nurse can make a difference. It begins, each person beginning with themselves, examining their own practicing what they like about their practicing, how they could expand. Jeanette Schoen was a very early adopter. She is a nurse in the Holland Bloorview Children's Rehabilitation Hospital. She read my book, thought what they were doing with families, that they could do better. She adopted some of the ideas and the practices, saw that it made a huge difference in how patients responded, how families responded, and then contacted me and asked me whether I would coach her. And this woman, single-handedly, a bedside nurse, started to engage other nurses on her unit, started to engage her manager and the leaders, and now they have now adopted strengths-based nursing throughout their organization and are totally committed to strengths-based nursing. And social workers are on board, and pharmacists, etc. Began with one nurse. This is a huge project that I am now the principal investigator of. We had a first grant, and now we have a very large grant, and it's about transforming nurses' work environments through a strengths-based nursing leadership and management training. So basically, what I discovered and what I felt very strongly was that we would only transform practices if nurses who were providing the care were working in a workplace environment that was healthy and productive, and where they were experiencing the same type of way they were being treated as we expected them to work with and treat our patients. And so we got the first grant, which was creating a SBNH leadership training program for those who are supervising and creating those workplace environments for those who are giving care. And it's a very large grant. It's a multi-million-dollar grant. It's a multidisciplinary grant. It's being run obviously at McGill University. We're 10 co-investigators, we're 10 collaborators. We have staff, students. It's really quite a large grant. And it is a brand new leadership training program based on SBNHL with the same values, but in terms of how these leaders lead and manage their units from this same orientation as SBNH for care. And these are the people who are part of this partners. And what's exciting is that we have Sick Kids and Holland Bloorview and McGill and Concordia and the MUHC and Centre West and ODIM. And it's very interesting. Now these three institutions in Quebec, well, all the clinical sites have now may decided that SBNHL will be their philosophy of care, and they're all now creating positions, dedicated positions, to transforming their institutions to adopt this as their culture within their institutions. So they are really committing to this as the approach. We are also in the process of building a culture of community, building, connecting, and collaborating across the world. When I talked to you about the community of practice, the Commonwealth Conference, we had a symposium on SBNH at the Commonwealth Conference in England, and because SBNH is being adopted. We said the languages, there's pockets of commitment in Australia, Belgium, Brazil, Britain, Burkina Faso, China, Canada, Japan, but there is really exciting work going on around the world, across universities in Canada, and was just in Switzerland and Brazil, in healthcare services and in private agencies. And this approach is really catching on, and we're hoping I think it's in July, I'm giving a talk at the Canadian Nursing Association, a change maker talk, and we are hoping we'll have a global check-in where people around the world who will be telling us what they're doing with SBNH, where they're at, and hopefully what we're hoping to do is create communities of practice and connect people so we can all learn from each other, really to create an SBNH community. And I'm going to leave. This is this is Diane Loudon, who was a clinical nurse specialist and who talks about, does a strengths-based nursing fit in today's reality and why it's important. And you asked me to talk about its relevance and its significance. I'm having problems getting this going.
Having that as a framework, a strength-based approach as a framework is, I think, critically important in these times, because we are faced with an exploding population in my particular population that I work with. The resources are shrinking. I think nursing is being tremendously challenged at this point in time. And I think as we go through our day and we're overworked and under-resourced, I think it's critically important that we have a framework that we can come back to really stop and think, what is it that we're here to do? Who do I need to be doing that with? And I think being able to really step back and understand what is my focus when you're feeling as though you're losing that focus just because it's so, the numbers are so overwhelming. So I think it's being able to have that sort of backbone to sort of back you up when you're thinking, how am I going to decide what it is that I'm here to do today, and how is it that on the individual family level or on the population level that I'm going to be able to really make a difference. I think.
So these are, I'm just going to summarize now the take-home messages. It's a shift. SBNH is a shift that can humanize care for patients, families, as well as healthcare providers. It gives nurses a unique and distinct role in health and healing. It is a value-driven philosophy that guides actions for clinicians, leaders, managers, educators, researchers. It is a way of being. It's how you show up in every situation. It integrates the biological, the personhood, and social. So you could look for strengths at the physical, person and social level. And it's about creating workplace cultures and environments of respect, compassion, caring, equity, and inclusion. And so the last word must go to Florence Nightingale. And at the Congress on Hospitals, Dispensaries, and Nursing in 1893, this is what she wrote. May we hope that when we are dead and gone, leaders will arise who have personally experienced in the hard work of practical work, the difficulties and joys of organizing nursing reform, and will lead far beyond anything we have done. And we are hoping that SBNH builds on Nightingale's legacy and that we will lead far beyond anything that she or we have done. So thank you very much, and I will return. I know I ran a bit over, but I we started late, but I'm more than happy to take some questions.
Thank you so much for the very interesting presentation, Dr. Gottlieb, about this Strengths-Based Nursing Care. So in the open forum part of the event, there are two ways to ask your questions. So first, if you're using your laptops or desktop computers, you can do this by clicking the icon label reactions found at the bottom center in the right part of your screens, and then click the raise hand button. If you are using your mobile phones or tablets, you can click the three horizontal dots or the more option found at the bottom right corner of your screens and tap raised hand. Another option is to simply type your questions on the chat box, which is accessible at the bottom part of your screen. Make sure your message is directed to everyone. We will now start the open forum. And while we give time to prepare for your questions, may I introduce to you another attendee who is in the Philippines as of this moment. We are joined by Ms. Elizabeth Delfinado Monsale, the officer in charge of Valladolid District Hospital in the province of Negros Occidental. She's also the granddaughter of our founder, Tita Maggie Calcetas. Maayong gabi, ma'am. Any questions from our participants? Yes, we have Tita Cora, our ex-officio in our organization.
Yeah, you hear me? Do you hear me?
Yes, we can hear you, Pop.
I have a questions about the book. I just want to know if is there a new book that Dr. Laurie Gottlieb
Has written?
wrote, or because I had the old book, so I want to ask this question.
No, it's still the ones that's in circulation. I haven't, stayed truth, had a chance to do the second edition.
It's still the same.
Yeah, and I'm writing a new book called The Essentials of SBNH, a practical guide. But I have not had, no excuses, I really don't have 5 minutes, but I am so looking forward to doing that book. We have been doing a lot of work with the SBNHL, the Strengths-Based Nursing and Leadership, and papers are starting to come out on that, and there will be a book on that too. So I've asked God for another lifetime, but he hasn't granted me another lifetime.
Oh, okay. Thank you.
So thank you very much.
Yeah. Another question. Since you are the leader of this new book that you are exploring or giving to all nurses around the world, you made some speeches. Do you think all these leaders, nursing directors who are involved, do you think they will be imposing this to their own hospitals or on their organizations?
Yeah, that's an excellent question. So that's why we wrote the article on how you implement this, take a philosophy and you implement it into the practice world. There is, we've written an article on that, but that's exactly what is happening. So I have been to France and Switzerland and Brazil and across Canada, that everyone is trying to implement. So the teachers want to know, how do we teach this? And so that's why we really need to create communities of practice, because everyone is trying to teach it, but we need to really create together. So there are, in Australia, there are different places that are trying to teach this and that have adopted this as the philosophy that undergirds all their curriculum. So we're seeing that, and we're trying to get people connected together, but that's already happening. Then in the practice setting, there are, as I just finished saying, there are hospitals who are adopting this as their philosophy of nursing. And then the question is, how do you convert or transform a whole hospital and create a culture of SBNH? And how do you create those climates? And we will be doing it two ways. The MUHC and the CS Centre West the Jewish General Hospital has just announced that they are creating special positions to hire somebody specifically to undertake this this activity. Part of it will be that they will be sending some of their managers and leaders to our training program, which is SBNHL, Strengths-Based Nursing and Healthcare Leadership Training Program. They will be sending them as part of them. Many of their staff will also be serving as mentors. So it's a slow process, but we are making huge, I think, huge progress. So the Hospital for Sick Kids has already transformed. There's a whole, the hospitals that have transformed has this as their mission and their values, and this helps them to actually operationalize. Many people say they're patient-centered, but they're not patient-centered. They need a philosophy that tells them how to be patient-centered. So we are seeing this happening at the clinical site level. We're seeing researchers. I just got a letter from somebody in Brazil who used this to do their research on and to study how you engage people. So it's happening on many, many levels. And I'm really delighted, but there is a definite need for, to help clinicians develop practical tools for this. And that's why, my book that I've been working on for the last few years, but haven't had a moment to complete it, but I've given myself 4 months, is to do the practical guide, to give clinicians actual tools that have been found to be very helpful. But we're developing a whole generation, like McGill adopted this as a philosophy that underpins both their undergraduate and graduate, all their programs. And so our students are coming out with this approach. And as they go into those clinical areas, they will be the leaders to help transform and bring this but whenever you see good nursing, you see SBNH. There are elements of strengths-based nursing. So for people to discover what they're doing, to start labeling it as strengths-based nursing, and then to broaden their ideas of what nursing is, and then to deepen their understanding through reflection and through studying and learning. But thank you very much. Excellent question.
Another question. Do you have a length of time? How do you meet? Do you have a deadline for this, or you will gonna continue this as your work? So it will be all over the hospitals, all over the countries that were involved. And how many times do you meet, or do you Zoom with this? Because of the pandemic, you Zoom. I want to know how many times you done with all this program that you're doing, Dr. Gottlieb.
It's a hard question to ask. I should have retired maybe 10 years ago. As you see, I have not retired, and I'm not planning to retire. And there's many people who are taking up this work long after I'm gone. This is work that continues. Florence Nightingale set the foundation and set forth the ideas that inspired another generation. At the School of Nursing McGill, we had this woman, Bertha Harmer, who in 1923 built on Florence Nightingale's ideas. And hers was the first fundamentals textbook in nursing. And she wrote 2 books. One was a fundamentals textbook and one was how to teach it. And if you read her books in 1923, she was the director of nursing at McGill in 1929. You could see how she built on Florence Nightingale's ideas. And if you look at my work, I built on her work and Dr. Allen's work, because her work, her values, her ideas permeated the drinking water at McGill University. So I built on her, and then I worked with Dr. Allen. I built on everyone's work, and hopefully somebody will come and continue to build on my work. Because as there's a saying, we stand on the shoulders of giants so that we could see further. So this is a non-ending, there's no timeline. This is about how do we reclaim nursing, because nursing got very lost, getting so caught up with wanting to get approval from medicine and this hierarchical structure. it's about reclaiming nursing, valuing what nurses offer, and the distinct role that nurses play in the healthcare system. Because after doctors do their thing, nurses create those conditions for healing and making patients safe. So it's an ongoing thing. It's making nurses aware of what they're doing, what their unique contribution is, and it's ongoing. And everyone is responsible for contributing to these ideas, and these will hopefully live on way past after I have gone. So I am sort of like setting another level and another stage and writing it down, articulating it. Somebody told me the best gift I gave them was to articulate and concretize what is the essence of nursing. And hopefully this is an ongoing, there's no timeline, it's never ending. What can I tell you? And it won't be for me to carry on, it will be for students to carry on, and it will be for other thought leaders to carry on, which is happening now. Because in every organization, somebody taking on, as I said, the greatest satisfaction I'm getting now with this big grant that I have is that I'm hearing people from business, from oral history, they're all part of our grant because we're all through stories. And they all are talking about nursing and how to really support nursing and how to humanize healthcare system through this approach to nursing. There is incredible value by all our partners, and it makes me very excited to hear them talking about nursing. And so when somebody asks me, why don't you drop nursing from the title? I said, you must be kidding. Not in my lifetime. This is ideas developed by nurses. These are the way nurses practice. We are not going to dishonor. And somebody just was at a conference, one of my colleagues presenting and said, somebody raised this as a question. I said to them, you should have asked them, what is the problem you have seeing nursing in a title?
Thank you. Thank you.
Thank you, Corazon Abdon, for your questions. And we will now go to Miss Esther Aurora. I saw her raising her hand earlier. You have the floor now, Miss Aurora.
Good morning, everyone in Montreal. And firstly, I'm from Florida, and I've heard about you, Dr. Gottlieb, from Maggie Calcitas, who is a fellow alumni from Central Philippine University, and that's when we visited Montreal 2 years ago with our dean. And I thank Maggie for personally inviting me to this event to listen to you as she speaks very highly and fondly of you. And I can see why. I have goosebumps listening to you. And I thank you for elucidating on, excuse me, on these ideas that perhaps many of us had in the past, but it has never been formulated. And as a retired instructor, I wish that I have all of this formulated during my teaching years. And so I say to you, please don't retire yet. I think we have another generation to inspire. And I am so very much inspired by you. And thank you so much for taking the time. And I look forward to meeting you soon. Thank you. Thank you.
You and any friend of Maggie's is a friend of mine, and Maggie is the ultimate connector, and everyone has a role to play. But Maggie, and I've always been very grateful to her for bringing me to your community, because I have the utmost respect and admiration for the way your community cares for, as I said, the world, but also cares for each other. And we have a lot to learn about a community and about what it means to care for people and to have compassion. So I am very grateful to Maggie, but I would love to meet with you. So next time you're in Montreal, tell Maggie to give me a call.
Thank you. Thank you so much. And I don't mean this very lightly. I think I messaged to her that I think I met one of the goddess of nursing today. And thank you, Dr. Gottlieb.
That's very humbling. You know, when I was writing the original book, I was working in King's College. See, I needed a sabbatical. And that was where Florence Nightingale founded the St. Thomas School, and it's considered Florence Nightingale. So every night after I finished working on my book at King's College, I'd walk over to Florence Nightingale and told her she was on my shoulders and we were going to bring forth this vision of nursing. So I feel very connected to Nightingale and very grateful for, as I said, if you read her work, and just not notes on nursing, but all her work, this was a very wise and compassionate person. I just saw a letter in which that my friend Lynn McDonald, who is the foremost expert on Nightingale, who brought together all of Nightingale's work into, she's not a nurse, she's a social scientist, into 17 volumes of 1,000 pages each, all her original work. I haven't read it, but I read some of it. But she just published an article, a letter that Nightingale had written to a soldier a soldier had written to Nightingale to thank her for her compassion. This is a soldier during the Crimean War who had lost his legs. And it's very interesting. I think the doctor wanted to amputate his leg. You know, we're talking about in the 1850s. And she said, no, she didn't think it needed to be done. And she really saved his leg. And he wrote her to thank her for this intervention. And she and basically it was basically nursing and her observations, but it was a beautiful letter of how she really understood the uniqueness of each person, took the time to get to know them, took the time to understand not what was the matter with them, but what mattered to them. And that's a beautiful example. And there it was, you know, this letter that has recently been found, and my friend Lynn McDonald just shared it with all of us. So, you know, this is really in the tradition of Nightingale.
And I'd like to add, thank you so much for taking interest with the Filipino nurses, because as you probably have gleaned that most of us were educated under the deficit model, and definitely your involvement with the Filipino nurses has empowered many of the Filipino nurses.
But
Thank you.
all of nursing has been educated under the deficit model, and basically this is where we lost our way. We've lost our way to have this holistic approach to really focus on who was important and who we were there to serve. So we all have suffered that. There's time to reclaim the essence of nursing. And I read once when they said, when you have lost your essence, you are in deep trouble. And I think it's about refinding our essence, because this is nursing. And I think COVID-19 connected us to our essence and connected the rest of the world to understanding that without nurses and without this type of care, people were in trouble, because it was nurses who brought the humanity, who ensured that patients were safe, who experimented and innovated with new ways of making sure patients were breathing, who were there and witnessed suffering. As I told you, I'm collecting these unbelievable stories, which I'm going to have to publish sometime, about that what nurses saw and witnessed. They had said every nurse should change their mask when they got wet at the beginning, because there were not enough masks, and nurses' masks were soaking, and they were not soaking because they were working hard. They were soaking because they could not stop crying over what they saw. The level of suffering was horrendous. And as I said, I'm doing these interviews because it's a project I proposed, and on my desk is a box of Kleenex, and every person who is sharing their story with me is sobbing and crying over what they witnessed. But I am so overwhelmed and I'm so humbled by nurses' humility, dedication, and selfless compassion. It truly is something to witness and to hear. And I think COVID-19 brought that to the fore. It really magnified and amplified nurses' contribution. And there's a reason why the public trusts nursing. And they were, when they were building all these big hospitals, when England was particularly hit with huge numbers who were falling sick so quickly and very ill. They built these Nightingale hospitals. And I said to my husband, this is crazy. They're building beds, but they don't have the nurses. They don't have the expertise. So unless we really start to really honor nurses, provide them with good working conditions and the respect that they deserve, we will have problems. So there's going to be a nursing shortage. And I get very angry when they go to developing countries and hijack their nurses when they are so badly needed in those countries. I think it's immoral, to tell you the truth. And I think we really need to start creating better working conditions for everyone to make sure that we honor and protect and take care of our nurses. We can't have nurses taking care of others unless we take care of nurses.
Exactly. I see amen that.
Yeah. No, as you see, I feel very passionate about this.
And also, I would like to thank the Filipino Nurses Association of Quebec for putting on this event. Well done, Quebec nurses.
Thank you, Esther.
Thank you so much, Miss Aurora, for those very empowering and very nice commentary to our quote-unquote goddess of nursing, Dr. Gottlieb. Now we'll proceed to, there are two hands in here. We'll proceed with Tita Maria Eloisa or Tita Maludi. You have the floor now, Tita Malu. Tita Malu, you're on mute right now. Tita Malu, you're still on mute.
We can't hear you, Tita Malu. Press the unmute button.
I think Tita Malu has some technical problems. We'll get back to you, Tita Malu. For the meantime, we'll cater Tita Mila Aquino's question. We'll get back to you, Tita Malu. Tita Mila Gobe, you have the floor now.
Can you hear me? Yeah. Whoa. Hello.
Hi. Yeah, we can.
Hi. Good morning. Thank you very much for your very interesting topic, Dr. Gottlieb. I just have something in mind I'd like to ask regarding the use of strength-based nursing care approach to establish trusting and collaborative relationship with patients and their families. This is thought, and because agencies and social services are great overload and increased pressure for the nurses too, would healthcare PR among the nurses in the in the section work, the healthcare public relations?
Can you close the door?
Yeah. To deal with let me see now. To deal with public.
I don't think I'm understanding your question. What's the question?
Well, to help to approach the patient and family, will a healthcare PR help in this situation, in this thing?
I think people. Let me understand. You're saying that if healthcare agencies adopted with
healthcare nurses, like
healthcare nurses.
Yeah, the nurses too in the workplace.
Yeah, of course.
They appoint somebody like a healthcare that will be mostly work on this as a PR for the families and
No, but as I said, this is an embodied approach. This is how you approach. So every nurse who encounters a patient family, if this is their approach, they're going to engage patients and families. Patients are going to get more involved in their care. Patients are going to learn how to develop the confidence that they have it within themselves to engage in more self-management. You know, we found out, and one of the nurses said this to me, you invest early and heavily into a person, they then will take over. So and I think this is what you're asking me. So in fact, one nurse at Maimonides said every morning, because the families could not visit their patients, she found that if she spent the time, if she gave 5 minutes every morning, called the family, gave them an update, told them what was going on, asked them what they could, what they wanted her to do, what messages she conveyed. They then never called her, so that 15 minutes that she spent early in the morning saved 2 hours of time during the day. And she found that if she invested and engaged them and involved them and helped them connect with their loved ones, it alleviated their anxiety. It's calmed the patients tremendously. That's real partnership. That's the definition of partnership. That rather than ignoring people, engaging them, involving them, making them feel that you're listening to them, helping them identify what they would like in the situation, working with them together, that they then will take on and become much more self-sufficient, more manage more. And also we find that when you do that and you really listen to what people need, they won't come back and they won't use emergency care. It saves a tremendous amount of money in the long run. If you want to talk about the system has been so worried about efficiency and how much time, it's ridiculous. Adopt approaches that are effective and compassionate, and guess what? In the long run, they will be the most efficient, the most efficient solutions to your problems. So I think that's what you're asking me, if I'm not mistaken. I hope I've answered your question.
Yes.
But it really is about how people, if you believe people are self-healers, how you give them the tools and the skills and the attention and the know-how, that they feel confident and comfortable in knowing when to call you and how, and you know when they call you that it's important, and they then become much more self-sufficient and they take on more of the self-management. In other words, we're treating people like adults and like human beings and not like we're there to fix them like children. That's the problem with the paternalistic system. You treat people like children, and guess what? They respond like children. It's having the deepest respect for everyone, because you're identifying what they're good at, what they do best, and how to help them recognize that within themselves. And they will find their own solutions. People, families, people are incredible. Look at Rabbi Kahana. The inner spirit of this man is truly incredible. It's with being a quadriplegic that he has discovered a different part of himself and that he is developing. And he's a joy. He really is a joy. And he brings joy to everyone because of that. So that's his personality. You know, you have other people who are very difficult and cantankerous, and those are the hard people. Those are the people that are not as likable, but it's really taking the time to discover who that person is. And one of my colleagues, and it's in the book, said that she really had problems with this patient. She really didn't like her, to tell you the truth. And one day she was, the woman was dying of cancer, brain cancer, and her head was very large. She said, I would like to flip, she wanted to flip her pillow. She said, I'd like to flip your head. And the woman said, if only you could. And they started laughing and they connected. And once you have that connection, all of a sudden her perception of that woman began to change, and their interactions and their relationships began to take up, because she began to see her humanity. We have to see each other's humanity. We've got to connect to that humanity.
Focus on the patients. Thank you.
Thank you for the question.
Thank you, Tita Mila, for your question. And I think Tita Malu is not here yet, but I just want to read what Mr. Mr. Alibog has message in the chat box. I will read it for the benefit of everyone. So he said, thank you, Dr. Laurie Gottlieb, for the excellent presentation of NH rather. Very current and timely theoretical framework, especially that we are facing the challenges of the pandemic. It's true we need to focus on the patient's remaining capabilities where we can draw hope, inspiration, and motivation to continue the healing and caring process. We would like to embrace SBNH here in the Philippines. And he added, may I invite you to speak at the Central Philippine University College of Nursing, the first school of nursing in the Philippines. Thank you once again.
Yeah, now I want to ask you, could you, is he still online? Because I would like him to get in touch with me.
Yes, I will put him to the spotlight.
Mr. Ali, Ali Boga.
I'm still here,
Oh, great.
Dr. Gottlieb. Thank you very much for your philosophy of nursing.
Yeah.
We would like to embrace a paradigm shift from deficit model to strength-based nursing and healthcare model here in our school. So I am trying to introduce your theory to our students who are practicing in their internship program, as well as in our base hospital. So later on, I will keep in touch with you to invite you to a larger audience here in our school. We have more or less 1,000 students from level 1 to level 4. And we would like to embrace this model for our future undertakings. Thank you very much.
But Mr. Alibaga, what I'd like you to do is get in touch with me, because we're now doing a survey of everyone around the world who's engaged in this, because we're going to have, as I said, a global cross-world checkup. And so I need you to get in touch with me, send me an email, so I have your email address. You could be part of our community that's growing, and I'd love you to be part of our community of practice, and to really, so that we're all working together, learning from each other as we try to create this into a movement to transform healthcare. So I am so thrilled and delighted to meet you, to know that you were on the call, to know that you were here, but you can't get off the hook. I want you to connect with me so we can engage you and you could become part of this community. So please, when we get off the phone, do you have my email address?
I will ask Manay Magi for your email address.
Okay. And I'll be waiting for your email, and then you'll be hearing from us, because this would mean so much to me, to know that that what's happening, that this is part of that you're embracing these ideas. I hear it also in Africa, because this is something, you don't need fancy equipment basically, and you don't need big investment. You need investment in yourself, in your own ideas, in your own manpower, in your own mindset, and this could have a huge effect. I'm thinking of Muhammad Yunus, who got the Nobel Prize. When he went into one of these very low resource countries, they had poured billions of dollars, and he said, we're pouring billions of dollars. Why hasn't anything worked? And he said, and then he looked around, he said, so what keeps this society going? And that was a strengths-based question. So what are they doing, and what are they doing right? And he recognized it was the women who were keeping this society going. And so he said, what happens if I make available money as a banker, microfinancing to these women? And that's what he did. And he got the Nobel Prize for this, but that's what he did. And basically he changed the dynamics in that country. All the women paid it back. They changed the economy of the country. One little thing can make a huge, huge impact. And basically that was strengths-based thinking. He said, what's working here? And how can I mobilize what's working to really enlarge and have a larger impact? And that's what we're trying to do. This is something that could have a large impact in terms of humanizing care. But we begin by taking care of nurses and changing their mindset. But so thank you so much, Ali. Mr.
Thank you too, Dr. Gottlieb.
Meeting you. Okay.
Thank you
so much.
God bless.
God bless you too.
Yeah.
Thank you, Mr. Aliboga, for that. And now we'll proceed to our president, Ms. Mary Grace Ocampo. The floor is yours, Ms. Ocampo.
Thank you so much, Dr. Gottlieb. What inspirational topics that you discuss. I like the way you emphasize that nursing should see the whole picture of the scenario. However, with this new generation and in our nursing situation right now, because of too much tasks, things to do, more on paperwork, a lot of less interaction with the patients. We're missing this interaction, socializing with the patient and the family itself. When I started my nursing, I remember in the Philippines, we discussed this Florence Nightingale. And then when I did practice my nursing here, at that time, we have more time with patient nurse interaction, more on caring, and we share and ask their feelings. But now with this generation, it's more on computer, and because the hospitals demand a lot of tasks in the computer situation. So I can see and compare my generation and the retirement generation, my mid generation to the new generation. It's more on the therapeutic of when there is a pain, we usually ask. Yes, we still do the PQRSTU. However, I can see and observe that there are more on right away medication instead doing the patient teaching. We're missing all the connection with the patient. We're not asking too much interaction with the family. Instead, we go right away. Oh, you have a pain? Okay. You have a headache? Okay. Okay, I give you this pain medication. But because we're lack of staff too, so I cannot blame my colleague doing that because of the missing deficit nursing in our situation. And now with this pandemic, we have to make sure that we have as much as possible social distancing with the patient. We have our mask. We cannot give smile to all the patients because of our mask, and our face shield are the less interaction you will gonna go with the patient because of your PPE. So it's missing. It's missing from where I started.
Yes, I appreciate your comments, but I would say two things. That's why we are training managers so that they hold the expectations, that they decide what nurses will do and what nurses will not do, and that if we value time with patients, that they create the structures and the expectations, that is part of the nursing. So it has a lot to do with managers, but it also has to do top down, bottom up. So if the managers and the head nurse, like Maggie was a terrific head nurse, this was the expectation on her unit. You spend time with your patients, etc. When you have managers who lead that way, who they create the expectations and they create the structures to give people permission that this is important and this is just as important as something else. So and you don't take on something that really does not contribute to patients' health and healing. The other thing is that you're right. You're absolutely right. Nurses with masks on and the PPE is distancing, but for some it's it really connects the nurses. There's one nurse that holds on who has a big smile over her mask to say to the person, I see you and I am smiling behind your mask and I'm trying to connect with you. Connecting with a person does not have to be an hour, a half an hour. It could be 5 minutes. It's when you're giving them even the medication. It's do you take the extra 2 minutes to connect with the person and to ask them a few questions. I've seen nurses hanging IVs and spending more time connecting with the person because their mindset is, I'm interested in you as a person. I'm curious about who you are. I have a few minutes I could talk to you even while I'm doing a task. If you're task oriented, you focus on the task. If you're person oriented, you focus on the person while doing the task. And so it's about a mindset, and you have the ability to choose your mindset. Because even when I trained as nurses, you're absolutely right, but I nurse very different than the rest of my classmates. And you can see it I trained in 1963. I trained when what you're talking about, but I could see there was huge differences between how all of us as students nurse, and it had a lot to do with our mindset and how we chose, it's a choice to show up with that person. So this is about choice at every level of the organization. It's a choice in how nurses choose to be with their patient, even when they only have 5 minutes. It's about how managers choose to protect their staff and create structures for their staff to practice this type of nursing. It's a choice by the director of nursing if they want to adopt this approach and what resources they need. And it's a choice by these things. And hospitals should not call themselves person-centered when it's all words. They don't know how to actualize it. They are saying it, but they're not. It's all rhetoric. It's not reality. If they want to create it into reality, then they have to make some choices. And it's all about choices, as we know. So your point's well taken, but I don't take it as an excuse. That's what I'm saying. I think we can be better, and we can do better. And we must do better. We must do better. If we've chosen, and it's very interesting, as I said, I'm doing these wonderful interviews, and nurses are telling me how this, being more with patients, doing more nursing, how it's really connected them to why they chose to go into nursing. And nurses are dissatisfied, and they're leaving the profession in droves. We're not having problems recruiting, we're having problems retaining them because of the work conditions. And when nurses are able to nurse in terms of why they chose nursing as a profession, they tend to stay. Job satisfaction is very much related to how they are able to nurse. Patient satisfaction is related to job satisfaction. I've just written a paper about this. So I've just gone through all the literature. So patients are satisfied when nurses are satisfied. Nurses are satisfied when they have autonomy and control over their own practice, and when they could do the way they want to nurse, they are allowed to and encouraged to nurse in that way. So, it all goes together. And if you talk about efficiency into the system, we must retain nurses.
Speaking of the mask, the face shield, I put the smiley face and the heart. So, and with our name, and
so people know you connect with somebody just even the way you touch them, because you have to touch them in order to turn them over, in order to give them, care. It's in the way you touch this person. I know when I was sick in the hospital, it's a way people touched me, whether you touch you as you're a lump on a log, or whether you're a person and you preserve your dignity and you touch somebody else's body with respect and you honor that body. And you could feel it in the way you touch. You could feel it in the way people even care for somebody, whether they do it in a respectful, dignified way, or whether they treat you as an object, something that needs to be done and get and leave quickly. And you can see it, and patients feel it, and they can see it.
I saw you. One of the sponsors is MUHC, the McGill, the MUHC. Are you gonna do some pilot, because this is a very good.
Well, the MUHC is one of our partners on this big grant, and they are in the process of interviewing. They have designated, put aside a special salary for somebody who will implement SBNH across their whole organization. So they have committed to that this will be their philosophy of nursing, and to be their philosophy of nursing, they have committed a full-time person, and an office just to do this. And the MUHC has Centre West, and ODIM is also going this way. And we have this at Hospital for Sick Kids, we have this at Holland Bloorview. It's, as I said, this doesn't take place overnight. This is a slow process, and you have to have a lot of, you know why people are called patients? Because we all have to have patience.
Yes. Thank you so much.
Yeah.
Thank you to Ms. Ocampo, our organization president. So since Tita Malu cannot figure out the technical difficulties happening in her phone right now, I'll just read what she messaged. She just wants to give a comment to Dr. Gottlieb, and she said, "Thank you for your time. We are very grateful for your valuable morning spent with the FNAQ members and colleagues." And we have another question from Tita Corazon Abdon. But before I'll get back to you, Tita Corazon, I'll just read some messages from our participants in the chat box. So from Rachel Angela Flores Altar, she said, "I think strength-based nursing approach is one of the solution from the fast changing technology effects which nurses nowadays are facing with the challenge. It opens a new angle wherein nurses can still provide the standard quality of care which we once had in the past. I am inspired by your genuine and interesting work, Dr. Gottlieb. It is a privilege to be part of this meeting."
Thank you very much. I'm touched.
And also from Mary Christine Burwell, one of our director for membership in the organization, said, quote unquote, "Yes, Dr. Gottlieb, that is what I teach my students or as a preceptor to new nurses. While taking vitals, administering medicines, engage in conversation with them. I am very interested in teaching SBNH as well. Thank you."
Thank you. No, we all have to become early adopters and champions, and we all could do something in our own way, even if it's by setting an example and then explaining what the example is. It's how we show up in how we choose to be. This is about how we choose to be. But thank you very much for those lovely comments. I am very inspired. I'm always very humbled to listen to these comments.
It's our pleasure, Dr. Gottlieb, and thank you very much as well. And now we will cater Tita Corazon Abdon. I guess this will be our last question for the open forum. And Tita Corazon, you have, or Tita Cory rather, Tita Cora,
Okay,
you
I'm
have
ready.
the spotlight.
Do you hear me? Do you hear me?
Oh yes, of course. Sorry,
Okay.
Of course.
First of all, Dr. Gottlieb, thank you very much for this nice speech that you touch our heart, our mind, and I'm very impressed for this book that you have written, and we all much appreciated it. And what my question is, what in your mind that you were able to write this book? I know you are a nurse before, and now you got your PhD to write this book. What have you been on yourself to write this book? So, if you want to implement in this new way of making the nursing more approachable and more care, that we can touch every patients in the hospital that we were involved to.
You know, I thank you very much for that question. I have written a book called Collaborative Partnership, and I had written another book called Dreams of No Expiry Date. Anyway, I had written a book, and I was starting to write, what does it mean to work with strengths? I know that, you know, I had developed this thing called the Developmental Health Framework, and it was about working with strengths. Then I thought, so I decided the only way I could know this and the only way I could answer this is to speak to talk to nurses who were actually working with people's strengths. And as I started listening to them, I realized, no, this can't be a book about working with strengths, because as I started writing it, I thought, this is much more than this. This is truly a philosophy. And you know what? I didn't write it. It wrote itself. I don't know where it came from my fingers, but as I was writing, I would write something and I looked at what I wrote and I thought, really? Is that what I wrote? It must have been so deep inside of me that it only came out in my fingers. And when I saw it on the screen, I saw what I was writing and what I was thinking. But this was really years and years of thinking about what nursing was, what nursing's contribution was, how invaluable nursing was. It's very interesting. I got my PhD in psychology because we had no nursing doctorates. I came back and started with two other colleagues the first doctoral program in nursing. I also started the first seizure program with Mary Barrett. We were one of 6 people who started it. So I've done a lot of firsts, but I came back to start a doctoral program in nursing. And when I could have called myself a psychologist, but I never called myself a psychologist. I have a twin sister who's a psychologist. She said, Laurie, you're a psychologist. I said, no, I'm a nurse. And that's who I am. And that's what I was born to be. And that's who I will always be. In fact, the very first photo of me, I'm a twin, and we were the first twins born of that year. And our photo was on the front page of the Montreal Gazette Star at the time. And so the very first photo taken of me is that of a nurse. It's being held by a nurse. A nurse named me because my mother didn't know what to call me, and a nurse told her that Laurie was a good girl's name. So I was named by a nurse. I was photographed by a nurse. My father was quite sick when we were growing up, but I never saw that. And I saw nurses coming to the home, and I saw the power of nursing. So I knew this was my calling. And so when I was writing this book, it's all these ideas I had about what the power of nursing was and how do we mobilize that power and make nurses aware of their power. And we have a lot of power, but we're not exercising the power. So the book started off by working with strengths, and it then slowly evolved and transitioned and transformed and became strengths-based nursing in healthcare, because I realized it was more than working with strengths. It was a whole philosophy of nursing. So I don't know how I wrote it, but all I know is that it was in my fingers, it was in my head, it was in my heart.
Thank you.
And I've been listening and admiring nurses. Although I have not been practicing directly, although, as you know, if you are a nurse in a family, you're everyone's nurse. My granddaughters don't know that I do what I do, but all they talk about me is, Granny Laurie is a nurse, and whenever we need anything, we call Granny Laurie. But they don't know that I'm a professor or that I write. I mean, that's not important to them. What they know is that if they need anything, Granny Laurie's there for them. So we're always a nurse, but I haven't been practicing, but I have so spent my time listening to nurses, listening to what nurses experience. They have taught me, as patients have taught me, what's important. So it's about being open and listening and being curious. So all my books are not based on sitting in my armchair theorizing, but more in terms of listening to nurses and listening to nurses' experience. They have been my best teachers.
Thank you.
Yeah.
Thank you.
Thank you, Tita Corazon, for your question and nice commentaries as well. Before I give the floor to our Director of Continuing Education, Aiza Alam, I'll just read another comment here in the chat box. It's from, I hope I pronounced your name correctly. It's Chris Shaline Ocampo. And she said, quote unquote, thank you, Dr. Gottlieb, for this knowledgeable and inspiring presentation of SBNH. The stories you've shared inspired me a lot. Thank you, FNAQ, for organizing this symposium. It is truly essential and very timely. God bless.
Thank you very much. Chris Shaline, I see her name.
And I'll give the floor. Sorry.
What was in that wall that my daughter happened to come across in London? So moving. The photos I showed you at the beginning, with all the nurses, and especially the Filipino nurses who have so given of their lives, the ultimate sacrifice to care for one stranger, to care for another stranger. It really speaks to our humanity and the very best of our humanity.
Yes, very indeed. I agree with that, Dr. Gottlieb. And for now, we'll give the floor to our Director of Continuing Education, Aiza Alam.
Hi, Doctor. Thank you very much for sharing strengths-based nursing approach with us today. Actually, I'm reading your book and I can't wait to finish it and will continuously apply and share it to the FNAQ family. I would say for all of us who have been on this wonderful and challenging journey of being a nurse, this is extremely important approach to become acquainted with and to be familiar with, because the knowledge and the guidance and all the wisdom that you conveys are all like truly powerful. And I want to share this phrase from your book, Doctor. Um, it says we need to gain awareness of those positives and work with them, because it is the person's strengths that will help them to face their own darkness. So focusing on strengths doesn't mean we are ignoring the problems. Instead, we use those strengths to balance and overcome them, right? And I think that is the essence of nursing.
I agree with you 100%.
Yeah.
That's what we talk about, leveraging strength to contain
Mhm.
or minimize. No, but that's exactly what it is. That's
Mhm.
exactly what it is. That's
Yes.
exactly.
Yeah.
Thank you very much for picking that out, because you've gotten the important point.
Mhm.
Very good, Asa.
And that's all.
Okay.
And I would just like to tell to everyone that if you need access of her book online, you can contact us and we could share it with all of you.
Okay. So I'm going to leave you now. And it really has been an honor and a privilege to be part of this community. And I thank you for the incredible opportunity. And as I said, I really have the utmost admiration, respect. All of you really inspire me. So it's very mutual. So thank you very much, Asa. Thank you very much for this invitation. And I look forward to sharing what happens about the SBNHL, our training program. It's going to be implemented in September. We've been really working very hard on it. And in about a year or two, we will be having results of the impact that this has had.
Once again, thank you so much, Dr. Gottlieb, and we appreciate your time. And thank you for all the participants.
Thank you.
And I would like also to thank again once the attendees from out of Canada, our two Ilonggo, Ilonggo attendees, Mr. Salex E. Aliboga of the Central Philippine University College of Nursing in the province of Iloilo, and Ms. Elizabeth Delfinado Monsale, the officer in charge of the Valladolid District Hospital in the province of Negros Occidental. Madamo gid nga salamat sa inyong presensya sa sining adlaw.
Thank you. So we
Thank
have
you, everybody.
Can we take photos before we adjourn?
Yes, I'm taking photos now.
Okay.
Thank you, everyone.
Thank you, everyone.
Have a
Thank
good
you,
day.
Have a good day.